Anybody that's had a stroke or a TIA is at risk of having another stroke. And those risks vary depending on the kind of literature that you want to read in terms of research that's been published. But on average, it's about 5% per year, every year for probably the next 5 years, something like that. If you've had a mini stroke or TIA, the risks are very high in the first week or two. So that's why it's very important to get to a doctor very quickly so that we can treat the risk factors very readily and reduce your chance of having a stroke. If you have a mini stroke, a TIA, you've got an 80% chance of having a full-blown stroke. So it's very important to get that sorted out. But the long-term prognosis really depends on the kind of stroke that you've had. If it's affected you quite severely in terms of physical ability, then obviously that's going to play out in the long term. And we need to put in strategies that can help you live your life. So if you need crutches, if you need support at home, someone to do the shopping for you, all of that needs to be put into place. So although the prognosis actually is pretty good following a stroke, especially if you're young, because the brain is plastic and it can rewire itself, people are often left with the long-term problems of stroke, which can be related to relationships, their carers. It often affects them quite profoundly. And the person that's had a stroke, they can get depressed as well. Depression is a very common finding in stroke, certainly on the long-term basis. And about a third of all patients with stroke will have depression. But the point that I want to get across actually is that there are lots of structures in place to help people recover. So the long-term prognosis actually is very good. We can help you get over the depression side of things. People often have very good family support, particularly when they're young. They've got a good incentive to recover themselves. We can get physiotherapy in, we can get occupational therapy, speech therapy in, and employers actually are usually very willing to be assisting in your recovery as well. So all of these things can come together to help you improve your long-term prognosis.